Welcome to Burlap Teachers. Enjoy the video.
You begin on clean skin with a lightweight serum so tools glide and you avoid tugging. Once done, grab a cooled roller for immediate relief and position the gua sha at a shallow angle. You'll work the neck first. Use 5 upward strokes per side, moving from collarbone to jawline because lymph drainage starts low. Make sure to keep gentle, steady pressure. You should feel movement under the skin, not pain. This sets flow before you move to the face. Next, you focus on the midface. Roll from the center of your face outward across each cheek with 5-7 medium pressure passes to encourage circulation. Once done, switch to gua sha for contour. Glide from chin along the jawline toward the ear in 3 to 5 deliberate strokes to release tension and define. For the under eye area, use the smaller curve with 1 or 2 very light passes. That thin skin needs less pressure. Make sure to breathe and repeat until you feel softness. To finish, you seal in hydration with a moisturizer or SPF if it's daytime. Pat gently so you don't disturb the newly moved fluid. Then clean your roller and gua sha with mild soap and warm water. Dry them upright to prevent bacteria. One key troubleshooting tip: if you notice redness, bruising, or discomfort, stop and reduce pressure. Switch to roller only and use a cool compress to calm the area. Make sure to adjust technique next session to avoid recurrence.
Thanks for watching. Consider subscribing if this video helped you.